People should attend the Palliative Care Conference because I think there's been an explosive growth in this industry over the past decade, and that's probably especially true in the past 5 or so years. And anytime there's rapid growth in an industry, there's an opportunity for misconceptions.
I think probably the biggest thing to know about palliative care is that it helps to reintegrate and synthesize the patient beyond just their illnesses or sicknesses. I think it's important that they know that we're about quality of life, and palliative care is oftentimes conflated with hospice care, which it grew out of, but does not require that the patient have a life-ending illness. Instead, palliative care is around comfort for the patient, support for the patient and their family as they face serious illness.
As I said, we've been doing it for years, just calling it something different, patient-centered care. And we're letting patients direct what they want to do, what they're comfortable with, what makes them uncomfortable. Some things we don't agree with, some things we don't like, but it doesn't make any difference. It's not our life, it's their life.
I think palliative care is so important because it's really around supporting the patient and providing them with comfort. So much of contemporary medicine is reductionistic, meaning that there's a part for every doctor and a doctor for every part, but nobody really thinking about the patient as a whole. Some of the information the Center for the Advancement of Palliative Care talks about reintegrating the patient. So there's a poster of a woman with cancer, but she was originally a dancer, so the C is made into a D. Similarly, for chemotherapy, they emphasize the word mother in the middle of chemotherapy as a way of showing that it's not just the disease we're treating, but it's also the patient and their family.
I think all providers have and seek to take a patient-centered approach. But because palliative care is kind of designed to be an overlapping team and kind of an overlapping service with other teams, primary care and otherwise, they have a different focus, and that focus is really to kind of keep the patient's expectations about their disease and also their goals about their disease and how they're going to manage it front and center.
Long-term care has an opportunity, again, in that continuum, to work with a group of people from all different aspects of healthcare in this state. And the more we sit down and talk with each other, the more we learn together, the more we do the same thing, again, I think that the patient care is a whole lot better. I highly encourage all of you to join us on September the 27th. We have a world-renowned speaker. We have education galore. We have networking opportunities. We think that this is probably going to be one of the most exciting seminars you can attend this year.